It's devastating to think that since 2010, heroin-related deaths have increased in Maryland 88%.
This is something our whole community needs to recognize.
In 2014, we lost 500 people in our great state because of heroin.
It's affecting everyone. It's affecting people just like me.
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 Just like a lot of people, all races, all ages, all classes. In fact, that's the message that public service announcement is trying to spread. Heroin is a problem. It's getting out of hand, not just in Maryland, but all over.
And a study out just this week backs that up. According to the Centers for Disease Control and Prevention, heroin overdoses nearly quadrupled. The report shows more than 8,000 people died from a heroin overdose in 2013. That's nearly twice the number of deaths from 2011. And get this, the report shows the number of heroin users jumped by 63% between 2002 and 2013. So, who's to blame for this surge? And why is it happening?
Well, first, we're going to tackle the who. The CDC report found people most at risk for addiction include whites, men, those who are 18 to 25 years old, people who make less than $20,000 a year, those on Medicaid, and people who are uninsured. However, the report also touched on the biggest increases in heroin use. They include women, people who have private insurance, and those who have higher incomes. It's a troubling trend, and the people who it's affecting and the rate at which it's growing are taking many by surprise.
Usage among different groups is growing. We see usage among more affluent people.
77% of the people who are IV users in our program use heroin. That is an enormous number. It's huge. Treatment is expensive.
Addiction counselor Elsa Peterson says if that's the number of people who are seeking treatment, imagine those who aren't seeking treatment. The numbers would just keep rising.
Now let's get to the why regarding this jump in heroin use. Experts believe one reason is that heroin is being mixed with the lethal drug fentanyl,
which is a synthetic opiate, extraordinarily powerful, about 100 times more powerful than heroin.
Another reason, people who take prescription painkillers may switch to heroin because it's often easier to get, cheaper because there's more heroin being brought into the country. No doubt, heroin is a growing problem, but it's a problem that, with the proper steps and knowledge, can be tackled. So joining us today to tell us more about it is Dr. Michael Finnegan, who is the Director of Peninsula Mental Health Services, and also you have been recently named a member of Governor Hogan's Heroin and Opioid Emergency Task Force.
Yes, that's correct.
Thank you so much for talking to us today.
You're welcome.
So just how big of a problem is heroin on Delmarva?
It's a huge problem and growing exponentially. In 2014, we lost over 800 Marylanders to just heroin and opiates. Wow. And that rate is expected to increase in 2015, and a 25% increase in the number of deaths from 2013. So it's a huge problem.
That's huge.
How did it become such a big problem?
Yeah, the two primary reasons. The drug cartels wanted to expand their market, and so they made it what they would refer to as a clean drug initially, so somebody can snort it. But the addictive qualities are still extremely high, much stronger than other drugs, and addictions can occur very, very quickly.
Why? What is it that makes heroin so addictive?
Well, it taps into sections of the brain that have to do with pleasure centers and pain centers. And then the administration, the route of administration, either through injecting it or through nasal administration, produces a very, very rapid intake going right to the brain.
Oh, okay.
Who are these people who are getting addicted to heroin? I mean, what does the average heroin user look like?
Right. The average heroin user has really changed. Now we have mothers and fathers here on Delmarva. We have high school and college athletes who have experienced a sports injury, had surgery, then placed on pain medication, and then could not get off of that pain medication. That we have aunts, we have old individuals. Worcester County has a significant problem with opiates in Worcester County because of the population. Those individuals did not come to it through illicit, not going to the dealer on the street, but having gotten it through their physician, but then it gets away from them.
So I understand one of the difficult things is if you're the family or a friend of someone who is addicted to an opiate or heroin, you have to remember not to take what they say personally.
Right. We used to think of addiction as a character problem. It's not a character problem. This is a disease. We need to see it as a chronic disease similar to diabetes. It takes a lifelong approach with bringing to bear many different resources. And that's what we're doing in Maryland now. We're collaborating, we're getting together with the corrections departments, with law enforcement, with outpatient treatment centers, with medical centers, vocations, all coming together to support the families, multi-generational families, so that young mother who just gave birth to a baby, who's addicted, both the baby and the new mom is addicted to opiates, helping her to strengthen her capacity to abstain from the opiate use and to take back her life, because those lives can be taken back. You can recover from that and have a wonderful life, but it takes lots of people in the community all working together.
And you can get over the addiction, but you always have to kind of be cautious because there is a relapse possible.
That's true, and that's true for a good marriage. You have to continue to work to have a good marriage.
Right.
And it also works with diabetes, and it works with our physical health. We have to continue to exercise. We have to continue to engage in healthy and good behaviors that allows us to deal with the difficulties of life instead of having heroin or opiates as our wingman, you know, the turn-to agent to deal with the problems of life.
So if somebody does relapse, is that going to be their last time?
It can be. The rates of death, as we said, are very high. But we have new medications that are reversing the effects, but that these are medication-assisted treatments. I don't want people thinking that you can simply take Suboxone or methadone, and that's the solution.
That's it.
Because Suboxone and methadone doesn't teach you how to deal with stress. There are other medicines that block the effects of heroin, which are very exciting, that will assist individuals to be compliant with treatment programs so they can get their lives back.
Maybe someone you love or someone you know, you suspect maybe a heroin user. Are there any kind of signs that you can look for?
Yes, a significant variation during the day in their overall activity levels. Heroin is a very powerful drug, and so it can cause an individual to appear sedated or somewhat out of it. But as the drug is wearing off in heroin, the trick of heroin is that it only lasts for 2 to 4 hours. It's a very, very short effect. And so the individual starts going through withdrawal. And so what happens is that individuals will start feeling sick. And it gets to the point of where you are trying not to be sick. All you're trying to do is to not be sick. Because without the heroin, you are sick.
You get sick.
It's like flu 50 times over.
Wow.
But the key is you can get through a withdrawal in about 7 to 9 days.
If you stick with it.
If you stick with it.
Now, you said something earlier about snorting heroin. You don't, it's not just required you have to inject it anymore.
No, that it can be snorted, and that is one of the roots why people think, well, it's kind of a safer drug. I'm not sticking a needle in my arm. Believe me, heroin, in the 887 Marylanders that died in 2014, it's not a safe drug. But it can also rob you of your power. There are individuals that say, just let me die. I just want to keep the high.
Right.
It is that powerful.
Wow. Now, if you are a family member of someone who is addicted to heroin, what would you say to them if they had perhaps a son or daughter addicted?
There is help that is immediately available. One of the recommendations that will be brought forth by the governor's task force is that immediate access to care. And so what we're trying to do is that if a person calls, that they are provided care that day, that they're brought in and started in a treatment program. And there's a variety of different levels of care. One size doesn't fit all. There are individuals that will require inpatient care, but some young person who has been on Oxycontin to deal with their sports injury, who has turned to heroin over the last 2 or 3 months, that individual doesn't have to go to inpatient care. An aggressive treatment involving the family, the healthcare providers, the addictions providers, all coming together, that can be done on an outpatient basis.
Okay, let's do a little role playing here. I'm an addict, and I just don't believe that I can quit. What would you tell me?
Yeah, there's lots of people, Jimmy, that have had that same feeling. And there's lots of people that have quit, who have gotten back and fulfilled their dreams. Remember your dream of wanting to be a sportscaster?
Right.
Right?
Yeah.
That those individuals who have been able to acquire that dream. You want to create that sense of hope and motivation. That is key. When we're looking at the research now on effective treatments for substance abuse, motivation and attacking the thought processes that create that sense of fatalism. I can't do it. And we attack that, maintain that increased motivation and support, and you know, people recapture their lives.
It's possible.
There's
Yes,
hope.
there is.
Dr. Michael Finnegan with the Peninsula Mental Health Services, as well as on the task force for Governor Hogan. Thank you so much
You're
for
welcome.
your time with us this
Thank you.
afternoon.
And if you would like to learn more about heroin, go to our website, WBOC.com. Click on our picture at the top of the page. Now, with everything we just heard, try to imagine how an addiction to heroin can turn your life upside down. It's something this Salisbury couple knew all too well. Up next on Delmarva Life, they sit down with us to share how years of heroin use impacted them and their family, plus what they credit for turning their lives around.
We also take a look at the many options available to those who have an addiction, or how you can get support if you're the one who needs it. Delmarva Life will be right back.